Hello children, till now we have discussed the cirrhosis, the changes of the cirrhosis, how the pathology occurs, what is the pathogenesis and what are the complications of the cirrhosis. The alcoholic liver disease are the most common cause of the cirrhosis. So all the etiological factors of the cirrhosis we will discuss one by one, how they develop the cirrhosis and what are the morphological features occurs in a biopsy or the liver. So excessive alcohol consumptions is a leading cause of the liver disease in Western countries, and about 67% of the populations of 18 year of the age or older drink alcohol. Then this 2 lakhs death per year occurs due to the alcohol abuse, and it is the fifth leading cause of the death in the all over world because of the automobile accident. And about 40% of the death is from the cirrhosis are attributed to the alcohol induced liver disease, and about 25 to 30% are patients are hospitalized having the problem related to the alcohol abuse. There are the three distinctive morphological changes are occur due to the alcohol, that is the hepatic steatosis, alcoholic hepatitis and the cirrhosis, and these all three are collectively known as the alcoholic liver disease. Fatty liver, this is steatosis, fatty liver, alcoholic hepatitis and the cirrhosis are alcoholic liver disease. That initially that normal liver is there, then exposure to the alcohol leads to the first fatty changes of the liver, steatosis of the liver, then it will change to the hepatitis or it may change to the cirrhosis directly also. This steatosis is a reversible condition with the exposure to the hepatitis. When the abstinence of the alcohol is there, then it will change to normal liver, or directly when severe exposure of the alcohol is there, then directly change to the hepatitis, but it is also a reversible condition. With the abstinence of the alcohol, it will be reversed to the normal liver. Or if there is a steatosis, then severe exposure occurs, so it may change to the hepatitis also or cirrhosis also. So when it change to the hepatitis, this may change to the normal liver, but when it will change to the cirrhosis, it will not change to normal liver. It is a irreversible conditions. So there is an interrelationship between these three diseases are there. Normal liver is 90 to 100% will change to the steatosis with the alcohol intake, and this about 10 to 35% will change to the alcoholic hepatitis, and about 40 to 50% of the alcoholic hepatitis will change to the fibrosis. This all will be reversible. This fibrosis hua, then it might change to the steatosis or it may change to the alcoholic hepatitis, then it will change to the normal liver, but it is very rare because it will finally change to the cirrhosis. So pathogenesis of the liver disease is depend on many risk factor, how it will develop. First is the drinking pattern. Drinking pattern of the alcohol, that it is limited at about 80 gram. When there is short term ingestion of the 80 gram of the alcohol oftenly taken for several days, then it will develop the fatty liver. If daily intake of the 80 grams is taken by the persons, it will generate the hepatic injury, so hepatitis occurs. But if more than 80, about 160 gram or more is taken daily for about 10 to 20 years, it will be definitely associated with the liver injury and leads to the cirrhosis and the hepatocellular carcinoma or complication of the cirrhosis will be there. So about 10 to 15% of the alcoholic generally develop the cirrhosis. Then another risk factor is gender. women appears to be more susceptible to the hepatic injury than in the men. Why? Because of the estrogen effects of the female on the female. Then malnutrition, infections, you know about it. Infections, certain infection like the hepatitis C infections, that will produces the fatty liver changes. So that if associated with infections, there are more chances of development of or early development of the cirrhosis or steatosis, hepatitis and the cirrhosis, or alcoholic liver disease, ALD. We will short term use it. And certain genetic factors that related to the ethanol metabolism, genetic polymorphism for P450 or the LDH, ADH will be related to these changes. So pathogenesis, alcohol is absorbed from the stomach or the intestine and is metabolized in the hepatocytes. So through the circulation it reaches the hepatocytes and it is metabolized mainly in the liver by the three pathway. One is catalase pathway, alcohol dehydrogenase pathway, and microsomal ethanol oxidizing systems. This is P450 systems. So most commonly it is metabolized by the alcohol dehydrogenase pathway, and then the minor amount with the catalase and the P450 pathways. In an ethanol pathway or ethanol metabolism, that ethanol goes inside the liver and through the alcohol dehydrogenase in the cytosol of the this hepatocyte, that is converted to acetaldehyde. Then it goes in the mitochondria, and in the mitochondria there is the enzyme acetaldehyde dehydrogenase. It is converted to the acetate. This conversion of ethanol to the acetate, there is a utilization of NAD to the NADH. So there is a redox reaction occurs there, and this NADH causes the toxic injury to the or oxidative injury to the liver cells. So ethanol metabolism occurs by the three pathway. Alcohol dehydrogenase is a common pathway, and another is a microsomal cytochrome P450 pathway or peroxisomal pathway. By these pathway it is converted to this acetaldehyde, this one and here and here, and this acetaldehyde is goes in the mitochondria. There is a acetaldehyde aldehyde dehydrogenase enzyme. So in the mitochondria with the dehydrogenase enzyme, it is converted to the acetic acid, and this here it is utilizing NAD and NADH is formed. Here is also NADH is formed. This NADH is in the mitochondria, oxidation occurs to the NAD and reutilized normally, but in the ethanol excess is there, then it is not converted to the NAD, and there is a NADH will be formed here and causes the oxidative injury. NAD is reduced to the NADH, resulting in the increased NADH-NAD redox ratio, which is a basic biochemical alteration occurring during the ethanol metabolism. Normally, this in alcohol metabolism, that when the total metabolism occurs alcohol, then there is a formation of CO2 and the H2O. But when excess amount of the alcohol is taken, then there will be the partial metabolism occurs and there is a accumulation of acetic acid. This ethanol is changes to the acetaldehyde, then acetaldehyde changes to the acetic acid with the oxidation of this acetaldehyde. But and this acetic acid is changed to the CO2 and the H2O. But here this will not change properly to CO2 and the H2O. There is a accumulation of acetaldehyde inside the hepatocytes and causes the hepatic injury. So alcohol is there when taken by the person. This is converted to the acetaldehyde, and there is a NADH will be formed, causes the oxidative stress to the cell, and acetaldehyde also leads to the oxidative stress. This acetaldehyde will causes the immunological damage to the cell by the protease adduct, and this oxidative stress also leads to the lipid peroxidations and leads to the immunological damage to the cell. तो cell damage हुआ तो there is a necrosis and the inflammation of the cell along with the apoptosis. And this alcohol leads to the increased intestinal permeability. Permeability increase हुई तो endotoxins also be absorbed, और सबका detoxification कहाँ होता है? लिवर में. That will go to the hepatocytes, and hepatocytes में there is a Kupffer cells will be increased. So proliferation of Kupffer cells causes the release of the cytokines. So there is an injury to the hepatocyte by these cytokines, and this also causes this cytokines causes the stimulation of the stellate cells, as we have discussed about stellate cell transformations, and this will transform to the myofibroblast, and this will causes the fibrosis or deposition of the collagen in the hepatocytes or surrounding the hepatocytes. ठीक है, so there is a fibrosis and or the cirrhotic nodule will be formed surrounding this inflammatory cells of the hepatocytes. So there is a formation of cirrhosis. So hepatic steatosis, how it develops? It develops or results from the shunting of the normal substrate away from catabolism and towards lipid biosynthesis. So normal substrate का catabolism नहीं हो पा रहा है, lipid biosynthesis is stunted, and as a result there is generation of the excess reduced NADH by the alcohol dehydrogenase and acetaldehyde dehydrogenase. Then there is a impaired assembly of and secretion of the lipoproteins, and there is a increased peripheral catabolism of the fat. So by all these three there is development of hepatic steatosis. Then what detrimental effect of the alcohol and its byproduct on the hepatocellular function? The alcohol induced hepatic metabolism of the methionine leads to decreased intrahepatic glutathione level, and this will sensitize the liver to the peroxidase injury. So liver में glutathione से methionine जो formation होता है that is reduced, leads to the oxidative injury. Then another, there is a induction of cytochrome P450. इससे भी metabolism होता है P450 pathway से. So there is a this pathway will be induced. तो यहाँ पर टॉक्सिक जो ड्रग्स का मेटाबॉलिज्म होता है, टॉक्सिक सब्सटेंसेस का मेटाबॉलिज्म होता है, तो उनका नहीं होके यहाँ पे अल्कोहल का मेटाबॉलिज्म चल रहा है इन द एंडोप्लाज्मिक रेटिकुलम. सो there is a increased catabolism of the alcohol in the endoplasmic reticulum, and there is a increased conversion of the other drugs to the toxic metabolites. So that is the drugs का conversion toxic metabolites में हो जाता है. ठीक है. Then another effects of this, alcohol directly affect the microtubules and the mitochondrial functions and the membrane fluidity. Then जो acetaldehyde बना, that also have the effect, disrupts the cytoskeleton and the membrane functions. Then alcohol induced or acetaldehyde induced changes of the hepatocellular protein that create a new epitope. Epitope बना दिया to which the immune system reacts. So that act as a antigen, and there is a antigen antibody reaction occurs producing a inflammations and immune mediated hepatocellular injury. तो खुद भी एक तो इंजरी करता है एंड एसिटाल्डिहाइड इंजरी करता है, देन एक एपिटोप भी बना देता है जिससे कि हेपेटोसेलुलर इंजरी होती है. ठीक है. सो rather than the effects of this oxidative injury, that alcohol itself causes the injury to the cell. Alcohol is a food and can become a major caloric source also in a diet of an alcoholics, and it displacing the other nutrients and leading to the malnutrition. तो उनको absorb नहीं होने देता, खुद ही absorb हो जाता है. So it will cause the malnutrition to the patient and deficiency of the vitamins, many vitamins like the vitamin B12. So alcoholic liver disease thus is a chronic disorder, not an acute. It is a chronic disorder featuring steatosis, hepatitis, fibrosis and cirrhosis with the marked derangement of the vascular perfusion. So this was the alcoholic liver disease etiopathogenesis only. Then morphological changes related to this alcoholic liver disease we'll discuss in next lecture.